Thank you everyone for joining us this evening for our Being with Story Visitors Training. And if I can ask you, we'll mute our microphones now just temporarily. Tonight's training is made possible through our myself, Compassion, through the organization Compassion Community Care, where I'm the executive director. My name is Catherine Matuzzi Acosta. I am very happy to be with you this evening. And with me, we have our co-host, Alex Schadenberg, and I'll let Alex introduce himself.
I'm the Executive Director of the Euthanasia Prevention Coalition. Looking forward to spending a little bit of time with you tonight and tomorrow night.
Perfect. Thank you so much, Alex. It's a privilege and an honor always. And so with that, I'm going to segue into a quick video before we begin our presentation this evening, which is what it feels like to be alone. And this is a good capture of how ultimately many seniors will feel, even some younger adults sometimes, but often we see this in seniors as how it feels to be alone and lonely. And this was captured video a number of years ago now in the UK. So we'll share that here. Thank you all.
If you've never been lonely, you don't realise what it is like.
It feels as though you've been dumped in the deep end and there's nobody there to rescue you.
Well, you go hours and hours, never speak to anybody.
I don't think you'll ever get used to it. You know, it's always loneliness.
How do you measure loneliness when even trying to talk about it takes your breath away?
The room's just empty.
"91-year-old Margaret Nicholas has lived in this house virtually her whole life, first with her parents, then her husband and family. 2 years ago, her husband died. Now it's just her.
We used to do the garden together, do our shopping together. Everything was done together.
You obviously miss him."
We do.
Margaret's granddaughter takes her shopping and neighbours pop in to check she's okay, but it's everyday company she misses.
Some people would think me a bit odd, but I do chatter to my husband. I do it so I'm sort of, speaking.
That's the wife with the cousin.
Roy Croucher lives a short drive away. He and Margaret have loneliness in common. He lost his only son to cancer and then his wife for 50 years.
I'm always hoping that the wife will come through the door, but she never will. If you go out, you come back to an empty house, and it's loneliness again. And you're always waiting for somebody to call.
Roy says he's lucky. A friend and her family see him most weeks. But like Margaret, some days the only voice he'll hear is a call from a phone befriending service run by volunteers.
Julie rings up on a Saturday night because last Saturday she was the first person I spoke to all day.
And that's a long day.
It is a long day.
And how much difference has that made, that phone call that comes on Saturday night when you haven't spoken to anyone else all day?
Well, I always look forward to it. I always put that phone on the seat, ready to pick it up. And that's a great help.
The campaign to end loneliness says it should now be treated as a public health issue. Identifying the most vulnerable is critical, then offering support to cope with the bewildering and painful reality of ending up alone.
I've never been on my own ever before. No.
And so getting used to that has been hard.
It has. I don't think I'll ever get really used to it.
It's just something that is thrown at you. You know, and you can't throw it back to anybody. you've got to just carry on.
That is a great opportunity to just showcase a little bit how often many seniors will feel. And this is often what we see is that if a person is alone, lonely, they may feel isolated. They may feel like they don't have anyone. And so what's important is really to be that opportunity to share in hope and optimism. And so tonight's training and tomorrow, which is part 2, I'm very encouraged to see everyone that's here. Some I see returning, some may be coming back as a refresher. Others, this may be your first time being trained with us. And what it really is giving you we would say, a very distinct, practical, effective way to volunteer in the community. And that's through the My Story Being With program. So being with others is why we've called it that. And the My Story is a way that we use a form of reminiscent opportunity and sharing of one's life and stories. And we'll share that with you tonight as well. We'll also touch on tonight, you would have recalled in the email that you would have been sent, you would have received a link to the manual, which will be literally working from tonight. So between Alex and myself, thank you, Alex, we'll be touching on our first topic, which is the keynote of caring for our own and why it's important to create a community of care so that we don't abandon our loved ones, our community members, our neighbors and friends. And then to take that idea and philosophy out into the community. And so once you've taken care of your own, how can we visit? And how does that start? Well, we talk a little bit about our human needs, what it means to be human, all of those needs, visiting advice. And then tonight we'll conclude with the My Story. And what does that actually mean in terms of how you can use that booklet and use that manual to, excuse me, speak to others in a way that's tangible, practical, and will give them the advantage of reminiscing their life story and in an effective way, bringing that into their life and offering them hope. Tomorrow night, we're going to speak about communicating with people with disabilities, advocacy at the doctor's office, and elder abuse and other problems. And we'll also take an opportunity to showcase some of our very engaging programs, such as our Seniors Calling program, as an effective means and parallel way to align yourself, if you're interested after doing this training, to be a volunteer and actually work with us directly. So without ado, I'm going to share my slide and we'll jump right in with having our first presentation with Mr. Alex Schadenberg. Thank you so much, Alex.
The whole concept of the Being With program comes from this very basic idea of caring for our own. It was actually in the very beginning something that was discussed when we were early on talking about compassionate community care. How do we care for those around us and make a difference? So the beginning is as I say, the culture of abandonment associated with this. You actually should go back for this first slide. Yeah. So why are we doing this? We want to be an advocate. I think that's fundamental. We want to be an advocate for people, make a difference in their lives. We want to support people out there and help them who are going through difficulties, especially when they're alone. We can do better when we support one another, especially our loved ones or old people. We can be better in our community. We can help people make a difference. But if someone gets sick, who's advising them? Is it us? Is our friends? Home care program? I'll just give you a quick example. We get quite a few calls from different priests, ministers, etc., mentioning how somebody in their community died by euthanasia, by MAID. And often they're wondering, what could we have done to make a difference? And that's not an easy question because everybody has individual circumstances. But the fact of it is that there was a lot of loneliness in this culture more than ever before. And one of the most important things we can do is by being with people in order to prevent euthanasia, assisted suicide. So now we move on. The culture of abandonment associated with assisted death or euthanasia can be changed when we care for others. Most people who ask for euthanasia or assisted suicide, it's not because of uncontrolled pain. It's not because of a lack of symptom management. It's usually because they feel like their life lacks meaning, purpose, or value. They're lonely. They feel that there's nobody in their life, or they feel like a burden on others. So it is essential that people who feel that their life lacks value or purpose, or feel that there's no one who cares for them, that they're offered purpose, support, and genuine hope from their significant community. So these are people in your life, your neighbors, your friends, the people you might go to church with, people who you know already, or through your community that you're in, that community has certain contacts that you would then meet with. The answer is to care and be with others as they journey through their difficult times of life. It's much harder to travel through these difficult times alone than with another. So a recent study at Copenhagen University. Now you have to understand that in Denmark they have a similar medical system to Canada in the sense that it's universal healthcare. But the fact is that they have an excellent system for coding, meaning they're able to follow up on patients very well and able to do excellent studies there because of how the system enables them to follow up on people so well. So this study looked at people who were lonely and actually didn't look at people who were lonely. It actually looked at people who had health issues. So the women who described themselves as lonely were 3 times more likely to have a heart attack within, than compared to someone who had an active social life. So they looked at all these people who had heart attacks in Denmark, and the point that they found out was that if people were lonely, they were far more likely to have another heart attack within the year. And men who described themselves as lonely were twice as likely to die within the year. Patients who were lonely were also 3 times more likely to be anxious, depressed, and they reported a lower quality of life. Now, some of that isn't surprising, but when you think about it, that loneliness does lead to a clear sign of an earlier death when they've had health problems. A survey of 1,896 seniors in the UK, 65 and older. Now, I don't think we'd be much different than the UK, a little maybe, but not too much. More than 1 in 5, 22% said they have a conversation with no more than 3 people over the span of an entire week. That's significant. A quarter of older adults said it makes them feel good when someone smiles or acknowledges them while waiting in line at places like a bank or grocery store. Well, in Canada, we never have to wait in line, so that wouldn't be an issue. I'm trying to be funny. Sorry, guys. Anyway, 1 in 5 would be thrilled if someone just stopped to ask them how their day had gone. So this loneliness is very, very much of a significant issue in the UK. According to the U.S. Census Bureau, now this was from 2020, 12.5 million older adults live in a one-person household, representing 28% of people age 65 or older. The National Poll on Healthy Aging reported that 1 in 3 seniors are lonely. Research showed that the chronic loneliness also impacted older persons' memory, physical well-being, mental health, and life expectancy. So more than a third of the seniors in the poll said they felt a lack of companionship, and almost 30% said they socialized with friends, family, or neighbors only once a week or less. An Irish study. Now, this was an important study because Ireland had been debating assisted suicide, and when they defeated that bill, the government instituted a study on the wish to die. So the study looked over a 6-year period and found that a wish to die was most often linked to loneliness and depression. The study followed 8,174 people over the age of 50 and found that 3.5% of those people had a wish to die. So that just gives you a general idea that 3.5% of people had a wish to die. But those who had a wish to die, 72% were identified as lonely and 60% had significant depressive symptoms. We need a culture that cares, not one that kills. It shows you that a wish to die was totally connected or very much connected to people's loneliness. In Canada, we've had incredible numbers of euthanasia deaths. We could actually probably take off those earlier years now, but the latest data we have was, this shows you 2023, but in 2024, there were 16,499 euthanasia deaths in Canada. That represented 5.1% of all deaths, and it was an increase, I believe, actually, of 7% from 2023. I predict actually in 2025 that we had 17,700, about 5.5% of all deaths. Quebec has the highest euthanasia rate in the world. Utilization of euthanasia continues to rise year over year, making Canada one of the highest euthanasia rates globally relative to total deaths. As I say, Quebec has the highest euthanasia rate in the world. Vulnerable populations. Critics highlight concerns that euthanasia is expanding beyond its original intent for the terminally ill, which has been increased by vulnerable individuals, the elderly, and those facing isolation or lack of support, according to a Global Mail article. In fact, today was the day they actually decided not to implement euthanasia for mental illness alone in Canada. Mental illness eligibility in early 2024, the government delayed extending euthanasia for mental illness until it was actually March of 2027, but now they've decided not to implement that. We'll see what happens actually, because it's not done yet. It's not done yet because there's still Campus Senate. Ooh, I'm bouncing back. Euthanasia for frailty was listed as a reason in 1,392 deaths, representing more than 9% of all euthanasia deaths. In 92 euthanasia deaths, frailty was listed as the only reason. I'm assuming this is the 2024 report. Euthanasia for chronic pain was listed as a reason in 933 deaths, with 23 of the deaths listing chronic pain as the only reason. Euthanasia for dementia in Canada was a reason in 241 deaths, with 106 of those deaths listing dementia as the only reason. Similar to other jurisdictions, the reasons for seeking euthanasia was highly oriented towards the person's social condition. Social isolation, 96% listed loss of ability to engage in meaningful activities. 87% listed loss of ability to perform activities of daily living. 70% listed loss of dignity. Now, there's a problem with this term loss of dignity because its meaning isn't the same for everybody. 55% listed inadequate control of pain. It actually was a little bit different than that. It was inadequate control of pain or fear of pain. It is important to note that loneliness and isolation was listed in more than 21% of all euthanasia deaths, representing more than 3,200 people. People with disabilities should be concerned that more than 50% of those who died identified loss of independence, and 50% listed being perceived as a burden on family, friends, or caregivers. Keanu Verifin, a 26-year-old, died after being approved for medically assisted dying by a Canadian doctor. He was suffering from depression. Keanu had diabetes, and he lived in Ontario, but he was killed by euthanasia in Vancouver by Dr. Weeb. He died at a funeral home. We'll move on. Why do people ask for euthanasia? I think this is the primary question because this is the question that we're trying to deal with as average people. We are told that people ask for euthanasia because of pain or suffering, but the data suggests that very few people actually ask for it for these reasons. If you look at the Oregon data, it's more clear, but in reality, when you talk to people who are asking for death by euthanasia, you also get that same response. There are some people who are radical autonomous, meaning it's my body, my choice. They're demanding death by lethal drugs, but they're actually the minority. Most people ask to be killed because they are at a difficult time in their life. They feel lonely, depressed, socially isolated, and have a loss of hope, meaning, or purpose. Euthanasia also threatens my life and your life. And why? Because you're a human. Human experience tells us that it's normal for a person who's experienced serious illness or personal difficulties and loneliness will fear for their future. They might question their purpose for living. They often will experience existential distress or situational depression, and they often lose hope. Loss of hope is often associated with depression, but in and of itself, it is something that's very lethal because someone feels that they have no reason to live. Suffering alone, loneliness, isolation, depression, loss of hope and purpose are leading reasons why people are asking to be killed, and all of us experience these feelings. You might say, "Oh, I don't believe in that." But when you're going through a difficult time in your life as a human being, many people have these sort of breakdown moments. By being with others, you can make a difference in their life. You can help protect them also from euthanasia. And the Compassion Community Care Charity was created to help people who experience difficult health conditions and to provide a training program for people to visit those who are living with loneliness and isolation. The Compassion Community Care Volunteer Training Program, which is we're going to start with tonight, gives you the tools to visit and be with others. We can change the world one person at a time. We can protect people by caring. So what are we doing? We're journeying with, we're being with, and we're caring for others. So what are we doing by doing that? Well, we affirm a person's purpose for living, right? We're reducing their loneliness and isolation. We're not trying to be psychiatrists. We're not trying to be psychologists or some sort of healthcare professional. What we're trying to be is a friend. We help them find a way through the depression and isolation, and we allay their fear of suffering. Why? We're just being with somebody. We're just providing that interdependent care. God created us to be with others. The human person is made to be with others. Interconnectedness is not accidental, but it's essential to the human person. So we're all affected by the legalization of euthanasia. Cultural loneliness affects our health, it affects our quality of life, and it's a threat to our life. We must focus on visiting the lonely and caring for our own and members of our parishes and our communities. We must replace the culture of death with a culture of care. You'll find, though, that when you're visiting people who might be going through a lot of questioning, and you get to know this person, you're visiting them, that often they become, how would you say, more vulnerable to the suggestion of others. So it's very important that you have these positive influences in your life. And the sad thing is the culture shifted on us, and we know that the culture shifted on us. People changed, we changed. Even people of great faith changed. The culture in the past was far more oriented towards the interconnectedness of the person, that we were interdependent. We needed each other. We were far more oriented towards visiting each other. But we have changed. Now the culture is far more individualistic. And we're recognizing that that's a severe problem in the culture that has led to the culture of death. We need to be a caring model for others. There you go, Kathy.
Thank you so much, Alex. So as we know, companionship is really what this program and this training is about. It's a befriending opportunity so that you can start to go out in the community if you haven't already, or if you're wanting to add to that opportunity to go out and be a person who's going to befriend those around them. And especially in a nursing home, a long-term care facility, a hospice setting, a hospital. Those are opportunities where people are sitting often and don't have access to people who are able and available to come and visit them. And so companionship, as this quote states, gives life its flavor. It is what ultimately grows communities that care. I will back this up with a recent example. We had a lady who did our training. She walked into a hospital to attend another appointment, but as she was leaving, she ran into a man who had just finished his dialysis treatment, and so he was a regular at this hospital, elderly person who had no one. And so she started talking to him, and it was a very nice conversation. And she remembered this training and thought, well, how nice would it be that we could connect like this? And so she got his number, but unfortunately the number didn't work, or there was a missed digit. And so she called me up and said, Kathy, I lost the number for this man I met. And I'm worried about him because I don't know how I'm going to meet him again. I said, well, go back to the hospital when you have a chance, if you have another appointment, or if you're going to have an opportunity to go by and see if you can run into him again. Because sometimes, same time, next week, you might find that he might be there again. And so she did that, and she found him. They started, talking. She got his actual number and connected with him on a regular basis. They were, became good friends. And he later confided in her after a few months that, if it wasn't for their friendship, he was considering euthanasia earlier, back around the time that they had met. And thanks to that one friendship that started just by, occurrence that they ran into each other and started talking, he had changed his mind. And he ended up dying actually naturally, not too long after that. So it is a very important point. I'll also bring up this note that we did a study a few years ago at the end of COVID and how the pandemic affected Canadians, seniors across Canada. And we interviewed over 500 Canadians. And in that survey, we saw that seniors that fared best through that process, through the time of COVID, experienced it in a different way. And for them, it was a time of endearment because some of them who stayed connected to those who were most important to them and continued in their community, friendships, relationships, be it even with one person, made the difference for them. They found it to be a positive experience and something that strengthened their relationships. Then there was the second camp of people who had disconnect from everyone, had no one, literally. And they found that a time of, depression, despair, loneliness, and even sometimes feelings of suicide ideation. And so they found that to be the opposite experience. And what the difference was is simply having someone in your life. So I really stress this here because your importance is key here, in that you offering this opportunity to someone, befriending someone makes all the impact. And that's why I encourage you all who are here tonight to join the movement. We have assigned, it's a collection of stories of ladies who were interviewed who happen to be in the area where we're based out of our home office in London. And they had done the interviews with ladies in the CWL. We collected those stories and we published it. And it's a wonderful collection of their testimonials. And so you can, read this over. It's online. It's a virtual publication, but we also have printed copies if you're interested. You can order one from the office. And it's a beautiful expose of women's lives and stories. And you can do this anywhere. Here are some photographs of Alex, myself across Canada speaking about this, and just great communities. Bottom left are two groupings of people who work as volunteers at a hospice. And so persons who are admitted to this hospice who are facing end of life are given a quilt, a handmade quilt. And that's their way of strengthening, those bonds. And they visit within that community as well, very effectively. These are some more communities that we've spoken to across Canada. The top large group is in Saskatchewan. We've been in all across Ontario as well. Excuse me. And these virtual sessions have been available to you really as a courtesy for anyone who's interested in doing this work remotely where they are. If you need to reach us, this is our contact information. You have that. And so everything that you've seen today so far is really this opportunity for you to look at how you can take this training tonight and encourage those in your community, go out into those places. Oftentimes people will ask, well, Kathy, how do I start volunteering? Well, first point would be is if you are part of a community already, be it a faith community or a seniors group or a community of concerned citizens that want to be advocates and frequent visitors, you can group yourselves as that grouping in your community and start to approach after the training, obviously, various centers and homes that you can go ahead and speak to their administrators and see how you can, get in contact with residents or with members of that community to start visiting with them. And so the first point would be to actually reach out to the administrators. If you have any questions around that, feel free to reach out to me. You can email me or call me. But ultimately, it's a good opportunity to sense out where there's opportunities in the community by speaking to those administrators and asking what community programs exist. Are there, in fact, any visiting programs already established there? There can be group visits that are coordinated. We often will go out and visit with moms, myself, and our children. And so we can go in and actually do crafts, and that could be a monthly activity, bi-weekly, or what type of frequency you prefer. So without ado, we're going to jump right in and start our Being With training. And so our first opportunity here is to really reflect on what are our human needs. And so we're going to touch on that right today, and we'll go next into visiting advice and then my story matters. So tomorrow will be session 2. So please make sure you come back tomorrow and join us for the same time, because it is an opportunity for you to continue and finalize and actually complete the training. So when we're talking about why we visit, really often what we mean by that is how it's important because of what we see. As Alex has said, there is a strong shift in the culture. We've gone from a community where people are connected to a place where they're often simply abandoned. And sadly, this is the case. We see this so often. We got a call the other day from a lady, a young woman, who found out that her great grandmother, and I can share this with you because she's provided permission, her great grandmother, who was 100, was scheduled to be euthanized, in a few days short of this call. And she was very shocked and saddened by this because this was the first time that she's heard about it. And sadly, we see this kind of erosion of connection in our culture. So there is this strong lack of companionship. And so what ended up happening was we spoke to this young woman, and although they are in completely ends of the spectrum when it comes to geographically speaking, this young great-granddaughter actually ended up having an opportunity to connect again. And so what's really beautiful about this is how we see that connection makes all the difference. We had another granddaughter connect to us who had been with her grandmother at the time, and this grandmother was booked to die 2 days out. And because of the consultations we went through and we were able to speak to this granddaughter, she was able to speak to her grandmother and actually change, the trajectory of how that played out. And in the end, the grandmother ended up dying one day after the scheduled date of mate, naturally. So she had, changed her mind, and through that, the whole family ended up being ultimately, converted to why it's important that this mother is supported effectively. And so by doing this, by going out and visiting, by connecting with seniors, you're going to see the reduction of loneliness naturally. You're going to see this drop in isolation. Why? Because you're filling the void. You're filling that gap which is present in our culture. And this is a cultural shift. We're returning back to the old days, to the tradition of going and visiting with each other. It's so pivotal. It's so, you would say, simple, but yet we've lost that tradition, right? We often will see too, when you're going and visiting, you're going to see how the person is behaving, how they interact, how they appear. And so you might see, there might be sometimes, occasionally, signs of self-neglect or abuse. So it's important to highlight that through our talk today and tomorrow, what that may look like, so you are aware of it when you, in fact, may, experience it and witness it. So we'll touch on that as well tomorrow. And also, by visiting, you're going to provide a strong sense of belonging and value. Really, you're going to be an ambassador of hope. You're going to be the person who is able to shift the mental framework of an individual who otherwise may seem quite down or depressed. I've heard of many of my friends and peers recently where they are feeling that they're in the sandwich generation. They're taking care of young children and they're taking care of their elderly parents who are aging. And so in that experience, the parents are confessing that, I'm older in my life and I don't feel so great or happy, as I used to. And so they're dealing with issues like, value and feeling like they're a burden potentially, or they just feel depressed. So it's important to really strike those feelings right on the head and actually go deeper and say to them, why do you feel this way? And we're going to touch on that as well. So our human needs are really ways that we can shift, because when, just like a wheel, you have, let's say 4 pins on a wheel, and if any of those pins are inverted, meaning pushed in, the wheel won't turn. So similar to this, it's like our human needs represent various ways that we can show up as, in an opportunity sense, how we can be with the person when we are visiting with them. There's 4 needs. There's physical, mental, social, spiritual, and all of these needs need to be met in order for the person to feel like they're actually valued and they feel that they have a sense of purpose. And so that will bring a huge bearing on their effect on their life if they don't feel like they still have value. And so this is an important point here, and we're going to strike how important it is just by sharing with you are these 4 needs, and ultimately how you can help bring up those 4 needs while you're visiting with them. So the first point here is our physical needs. And within that, we mean things like, obviously we need, proper nutrition, hydration, exercise. Oftentimes we see that people are not getting enough of, for example, hydration, especially coming into the now summer months. It's important to emphasize that, how much water are you drinking? And it's just not 1 cup of tea or 1 cup of coffee, but actual water, hydrating yourself properly. And making sure that you have proper nutrition, right? Discussing those important topics. Often we get calls from people like, for example, one particular person on our calling service who feels that she has inflammation. And often when she stops eating sugar, she will stop feeling that inflammation. And she was surprised how quickly it stopped because she simply took out sugar from her diet. And so something so simple can have big effects, and positive ones at that. So these are important points to bring up. Perhaps a person wants to go out for a walk. If the person is mobile and still able, maybe you can partake in that type of activity with them. Encourage their mobility. You can encourage seminars on health and nutrition and learning more about diet. You can encourage their sleep. What are their cycles like? Do they get enough sleep? We often see too that 90% of people over the age of 65 take at least 1 drug per week. And so as they age, we see that number increase. More than 40% take at least 5 different drugs per week, and up to 12% take 10 or more drugs per week. So this is an important point to mention. As we see that as someone gets older, oftentimes they may feel very different, and the drugs and the things that they're prescribed may change. We also see typically women take more drugs than men. And obviously, if persons are not drinking enough water, for example, they may experience dehydration. That's important, especially now in the summer months. If you combine that with working, let's say in the garden, that can actually induce feelings of intense fatigue and what they call this, it's almost like a feeling of tremors or early labor. It feels like they're convulsing. So that's dehydration. So it's important to keep note of that. If a person feels that way, that they don't continue on working, but they come inside, get rest, get hydrated, and slowly return back to a place of balance. And so it's important to bring those things up. Seniors often, if they're taking new medications, especially if they're prescribed a new dose, it's important to see how that medication interacts with their bodies and pre-existing medical, medications. So it's important to keep all that in mind as well. When someone has, we talk about mental needs, our brains require stimulation to stay healthy. So, for example, some people may want to have crossword puzzles or different puzzles, for example, that they can use to help keep their brain stimulated. Sometimes they want to keep, different games out. Doing, hand puzzles where you arrange the pieces together is a great way to do that. Often we see that in senior homes as well. Creating creative ways for them to strategize and discuss, even speaking about different issues, politics, which is very engaging for many people if they like those issues, obviously. It's a great opportunity to discuss. But also, we have to remember that the brain acts like a muscle more than an organ only. And it's, we want to encourage their, stimulation so that they have an opportunity to have an outlet, to stay healthy. And so encouraging them, watching, sending them positive videos or podcasts or informational seminars that they can be a part of is very helpful. We see also how this plays out with depression. Depression is a serious issue for many seniors. And what we see often is that there's different triggers for people who may find that they fall into depression. They often see that, depression, seniors are 4 times more likely to have alcohol-related problems than those who are not depressed. And so the other point here is that 80 to 90% of residents in long-term care homes have some form of mental disorder, and that depression is present in approximately 50% of residents. That's a huge statistic. And as we see people moving into community type of living, you think that number of depression will lower, but actually we see it increase. So it's because a lot of people feel isolated in those homes. They may be surrounded by more people, but they're not people they necessarily know or interact or have meaningful relationships with. So it's it can be a sense of withdrawal as well. That, of course, can turn into, depression can often be characterized by sadness, decreased appetite, insomnia, and loss of interest in hobbies. Often people who are institutionalized as elders, those with medical illness have the highest instances of depression, which can be as high as 70% following a stroke. So these are significant statistics. Excuse me. People who have depression are more prone to psychosis than are younger persons with depression. And psychosis is a severe form of mental disorder in which thought and emotions are so impaired that contact is lost with external reality. And sadly, when someone falls into more issues as they get older, it's harder to find and diagnose and actually medicate that. The subject, of dementia comes up obviously now. That's a progressive impairment of memory and other areas of cognition, which results in an eventually reduced ability to care for oneself. Dementia can develop in younger people, but it's rare. Over the age of 65, dementia affects 1 in 20 people. And for people over the age of 80, the number rises to 1 in 6. And so this often is a very important statistic. Many people with dementia refuse needed care or their children are uneasy with becoming caregivers. So people often who suffer from dementia frequently experience anxiety and depression early in the disease and delusions and hallucinations in the later stages. So it's important to keep that in mind. And then, of course, the idea of suicide, the discussion of suicide among the elderly receives very little attention, but it should be paramount because this is the crux of this issue. Studies have found that suicidal elderly people frequently consult medical services, usually a primary care physician, shortly before the actual act, sometimes in the last few days or hours prior to the suicide. Many primary caregivers appear to have a lack of sensitivity regarding seniors who have mental health problems. So it's very important, if someone speaks about suicide, to take it seriously. This is an epidemic of, numbers when you see so many people choosing MAID and euthanasia. So we have to keep this in mind, how often these cases can arise just by simply someone sharing, their feelings of depression, which ultimately can lead into that furthering case of euthanasia or suicide. Excuse me. When we're discussing social needs, this means often the lack of social relationships, and it becomes a strong risk factor for early death. It's just as important as, for example, smoking. There's a higher mortality if you smoke. Similarly, if you lack social, interaction, there's a higher mortality rate. It's similar to also obesity or lack of physical activity. We need interaction, right? And with others for proper brain function. And it also, it's the importance of friendships. Friendships reduce stress levels. Just by picking up the phone and talking to someone, you're reducing their feeling of social isolation. And often what we'll see is that 1 in 5 Canadians aged 65 or older indicate that they felt lonely some of the time or often. The proportion is even higher among those who are 85 or older, which 25% felt lonely some of the time or often. But if they're lonely or living alone, and they have health problems or disability or sensory impairment, such as hearing loss, and a major life event, such as the loss of a spouse, all have been identified as key risk factors for social isolation and loneliness. So when you encounter a person who's lost or had a big episode in their life, for example, such as that, then you definitely want to encourage them and be more, present in their life. It's very important, especially to check in on them, a month after a person has passed, significant to them, or, a couple months later, and just be continuously involved in seeing how they're doing, how they can be, positively, obviously impacted by your friendship with them. Very important here is that most seniors feel connected to their family, but fear burdening them with their own troubles, worries, and hardships. They are reluctant to talk about the meaning of life or after death. Instead, they prefer to talk about their fears and worries. So this is a key point here. If someone starts talking about being a burden, talk to them about, what is your fear? What is your worry? Because that's what's really underlying that discussion of idea of burden. Unfortunately, seniors often lack close relationships to do this because there's no one around to discuss it with. So being a friend is important. Call daily, even. We often see that there is this need sometimes for people to feel connected on a daily basis. Also, an interesting point here, if a person who's elderly says they're tired, it may not mean physical tiredness. Expressing the term tiredness was associated with the need to talk to others about their fears and worries. So again, those things are highly connected. Tiredness, burden, fears, and worries. So making that connection is very key. And then finally, communication. It's very important for people to be able to open up. The great way to do that is by our final session tonight, which will be about the My Story. In order to get people to open up, you share about your life story. You share about who they are, how they've become who they are now. And that's one way to do that, is through the My Story program. But in order to get to that point, you need to have a discussion and communicate. So communication is key here. Often close relationships or confiding talks with other residents in a nursing home are rare. Residents often feel that the other residents are impersonal or egotistical. Friendships are minimal because many of their friends are physically unable to visit or have passed away. So it's important to remain connected with people and find ways and opportunities to communicate. For example, using a smart device, if they have one, you can use Skype or things like Apple Video or FaceTime. It can be on WhatsApp video or even things like Messenger video chat. Those are all options. Zoom is another great one. We're training our newest senior callers to actually operate on Zoom because many seniors want to see a face. They don't necessarily just want to talk to someone on the phone. So this is new ways and great ways to communicate, and ways that are effective that will bring in a person and actually feel like they can open up more. Now, finally, when we're touching on human needs is, I think, one of the most important needs, actually, and would start from that discussion, which is the spiritual needs. Now, what does that mean? Those are the needs that involve your relationship with God. They are often characterized by, religiousness or religious beliefs, or need for existential, how the person feels, or spiritual needs. And so those words can kind of interplay, because people often will see that they're in varying degrees of each of those, or the way they reflect on their own life. So often, for example, this involves your relationship with God. It also is an indicator of how comfortable you are with yourself. So I see this often when people call, they may not be thinking about spirituality, but often they're very hard pressed to go deep and actually talk about themselves. And that is a key sign of the spiritual need component. How much they trust themselves, even how they forgive themselves. And all of that is found in this need. Though this is intrinsically a private journey, it can be shared with others. So, for example, praying. Oftentimes, people will call and ask for someone to pray with them on the helpline, or even on the Seniors Calling program through the volunteers we have. And this is very common because people want to express themselves in a way that goes deeper, right? And goes higher and further. Spiritual needs can be met in church. It can be through inspirational reading, meditation, or walks in nature, and it can vary based on the individual. The interpretation of whether a specific need is spiritual one depends on the individual's attitudes and cultural context. Research shows that with patients with a life-threatening or chronic disease, they regard their spirituality as a beneficial source of coping strategies. And because most elderly people today were raised with specific religious background, there may be some who are skeptical about using the term spirituality, and they recognize that they may view this term as being connected to the occult or negative. So just be aware of that. Some people prefer to use the term believing or instead of religious, because they may have distanced themselves from the church as an institution. Many seniors have a desire to attend a religious ceremony, but are unable to. So you can partake in that opportunity with them to help enable them to do so. So it's a very simple way to resolve that. Often spiritual needs may involve forgiving. And so why that's important is because a person has that internal inner peace. That is a key component of aging. As you get older, you want to realize that peace. And a lot of that has to do with forgiveness. Religious needs often can be seen as praying for and with others, or by themselves. They can become a member of a prayer group. That's something that's very open. It's becoming a very interesting way of relaying and being connected with other people, is being part of a prayer group. It's regular prayers that can happen on a regular daily basis, even you can be a part of. Others, there's even a prayer app, that you can get, and that can prompt you and remind you. So that's another thing that often people will often use. Participating in a ceremony, reading religious or spiritual books, turning to a higher presence, God, angels. A lot of that was quoted actually through the survey I mentioned to you through the end of survey of COVID, where people talked about the belief in one God being that one person, central figure in their life that got them through it. Existential needs often are needs that reflect one's previous life experiences. So, for example, the my story. How did they come to be who they are now? That will often showcase itself by talking with someone about the meaning of life or suffering. And so they'll see of who they are and how they feel and interact. They'll also talk about the possibility of life after death. And that's what that come through in terms of the existential needs. The need for inner peace is a desire to dwell in quietness, peace, and beauty. And so that may include talking to others about their fears and worries, and of course, being reconciled with those in your life who may have wronged you or you have wronged. The final need is forgiving. That is the desire to pass on one's life experiences to the next generation. Another way of saying this is generativity. It is a very important need to be assured that one's life has meaning, value, and purpose. This basic need may be fulfilled by using the My Story program. And so it's a great opportunity to showcase this in many people's lives. You may be connected to your own parents who are still alive or with you, to do the My Story with them. I was happy to do so with my own dad. He passed away 2 years ago. And thankfully, I did the interview with my own dad and father as he was an important part of my life. And so he was interviewed, and thanks be that I could capture his memories, because some of the memories I still reflect on and remind myself some of the stories he shared, which I wouldn't have known otherwise. I want to summarize this point here is how life satisfaction entails many areas. For an individual, there may be intrinsic, meaning my life in general, the health. It could be the social, the friendships, the family life. And it could be external, where they live or they work. And there's perspective. So, for example, their future, the financial security, all of that entails and is involved in their life satisfaction. Having one's physical, mental, social, and spiritual needs met results in person being at peace with themselves and the world. Unfortunately, very few people, and seniors especially, experience this. And so many seniors, when questioned, will regard the term need as too strong and replace it with wish. So do not ask, what are your needs? But rather, what do you wish for? This question may take a long time to answer, particularly as many seniors of those or those with a disability have, perhaps due to poor life experiences, stopped wishing for anything. But you can encourage them to speak of what they would dream of, even ideally wish for. You may be surprised to learn how many of their wishes are easily obtainable if someone intervenes on their behalf. So with that, we're going to segue into our next topic tonight, which is visiting advice. And so this really is an understanding of how important it is to visit. So when you go out, you'll notice that, visiting and being with others who need us most is key. You may see it in your own families, your partner's family, your spouse. This is important because a lot of people feel that they have been abandoned, and it's a very important undertone on all of this discussion. So we're asking you to join that hope. Start a visiting group. I have young children. I visit. There really isn't an opportunity why someone can't do this. There's no reason not to do this. It's a vital work. It's important to share it with others, especially those who have given us so much. People who've lived, they have so much wisdom. And wisdom these days is a hot commodity. Not often many people have it. And as I've been talking to more and more people, especially elderly, it's something they possess naturally, and they've been given that gift. And, it's up to us to be able to be bringing that forward. And so it's important to connect with them and realize that. And so one of the things when you're visiting is to do something called a wellness check. And what that means is check in first before you start visiting even. The day you're supposed to go out, you may feel not so great or you feel under the weather. Decide if you're actually going to go and visit. Reschedule them if you feel uncomfortable or if you don't feel well. If you are going to go ahead with a visit and you feel all right and you're healthy, some people will bring hand sanitizer. We often will say, please feel free to, bring that with you. You can wash your hands often and do a self-assessment, a test before visiting. See how you feel, because you often will see, the day of or day before, there might be things brewing and you may not feel so good, lethargic or whatnot. So if you don't feel well that day, don't visit. If you do encounter, you go to the visit. Often because we're post-COVID, now many people are apprehensive getting close in terms of physically. So you want to stay at least 6 feet or 2 meters away while visiting, just in the first initial few sessions, or at least the first day, because you don't know the person and they don't know you. So it is kind of a comfort and a barrier, but also a safeguard for them, that they may feel that you understand that. Also wash or sanitize your hands before and after visiting. And be prepared. Ask questions in advance to see what's required. Oftentimes we see this, that people will visit and, on the day that they're booked, you may call the center or the institution and ask them, is everything all right with visiting today? We've had that where a group of us were supposed to come in with our moms, like myself, and our children. And the administrator said, actually, you know what, we have a breakout of a virus, so we're not accepting any visitors at this time. So just be aware of that and be courteous. Obviously, you can reschedule the visit for another time when that's lifted. Now, when we talk about visiting advice itself, we're going to discuss all of these things today. So before you go, when you arrive, communication, nonverbal, emotions, conversation tips, and ending the visit and after the visit. When you are going to start visiting within your group, you want to make sure you have something called a criminal background check. This you can obtain easily from visiting, the police department sector that you're in geographically online. And so if you're based in the GTA, for example, Toronto area, you can go to Toronto Police and you can actually obtain a vulnerable sector check. This is the highest form of background check, and it is considered what they call the highest form, which is a vulnerable. Why? Because you're being introduced to members of the vulnerable community, either children or seniors. And so you want to request the vulnerable sector check, and that will include all things. And so you simply request it, and that is produced for you within 2 to 4 weeks, usually, time period. And again, if you need some support or help with that, navigating that or getting a letter in order to obtain that, feel free to reach out to us. Within your group or community of where you're visiting, you may sometimes see that groups may want to create an ID or some kind of, card that shows that they're members of an organization or that they're part of a community if you're going out as a community. If you're going as individuals, then obviously, you have your own name and you dress as you wish. Some have actually seen where vests that they want to be identified by, or like an ID as a lanyard. That's another point. Obviously, we want you to be, happy in terms of where you're going as you're visiting. And so you want to dress appropriately. The weather has been so shifting lately that, you have cold days and then you have, hot 30 plus degree days. So you want to be appropriately prepared. You want to maybe potentially think of ways how you can arrange the visit, where you're going to go. Are you going to walk around the facility? Are you going to go to the dining area? Do you want to go to any type of location within that property, if there is one, and simply be able to engage in that way. Sometimes properties have like a separate reading room, a study, perhaps a dining hall, or even a chapel. And that's a great opportunity to engage in discussion and dialogue as well. So thinking of where you can go, or if you're going to leave the property or you can go out somewhere, let's say for coffee, that's awesome. And it's great. And it's very stimulating. And often elderly seniors will actually appreciate that even more. So when you arrive, again, we indicate how important it is to have proper hand hygiene. Washing your hands is very important. You don't want to wear perfume. And that's one thing we stress as a visitor. You don't wear anything that has a strong fragrance or scent, like a cologne or perfumes. Omit all of that because that can be irritating and off-putting. And so often there's, people who may experience that in a negative way. And so we want to discourage that. And you just want to be able to be respectful that they may have some allergies or, they're not interested in having that. So we often will recommend that you wear clean, modest clothing, nothing too bold. Also, if you have jewelry, we often refer just to keep, perhaps a normal, very simple band on, nothing that could scratch delicate hands, because the seniors may have, obviously if you might put a hand on hand, you don't want to ever scratch them. So you want to have jewelry that doesn't really impede that and that doesn't affect them in any negative way. When you're walking into the room, you obviously want to introduce yourself. And especially if someone is hard of hearing or even vision has an issue with that, you will identify yourself and anyone else in the room. And if there is a shared accommodation, by saying, hello, my name is Kathy, I'm here to visit with Alex, you are able to then identify yourself, and others in the room may also recognize that there in fact is a visiting program available. They might be interested in that as well and having a visit in the future. Also, you want to ensure that during the visit, you're attentive, you're sensitive, obviously, and you're kind. You want to choose a time to visit that is appropriate for the person that you're visiting. So you want to have that set beforehand. And then, of course, you want to know their schedule. So don't visit when others are visiting or when there's other activities happening, so that they don't feel, not able to participate in other activities as well that they would like to go. And if for some reason you've set a time to visit and you're unable to go, always let them know. Make sure you identify that and let them know that. So it's important to keep that in mind, always be courteous. And if you're visiting someone who cannot speak, go in pairs so that the conversation can include the patient, the person that you're visiting, and find ways to be creative, brainstorm activities. Maybe you want to bring a picture or a book or a piece of music, or if you, draw, you can share that with them. It's an opportunity really to encourage and to empower them. So really whatever you think is important that you can share, that's a great avenue to take. Read to them. You could go for a walk, ask staff if you can take them off that area or ward, sing songs, playing games, have a cup of tea, and of course, if you can visit, opportunity could be to have a Zoom, right? Ask them if they're open to that as well. Now, in terms of visiting in a hospital, hospice, or long-term care facility or nursing home, keeping this in mind, always call the institution or the facility to check in what is required to begin visiting there. And if there is a patient who asks for a visit, begin with speaking to the nurse's desk and ask for the patient's room, and they will indicate to you where to go. Again, we recommend if it's someone you don't know, you always visit in pairs, especially for those you don't know. And please don't accept gifts. This is kind of a rule that we've taken that is beneficial because you obviously don't want anything to impede your visiting later. If there's some kind of family heirloom they've given and they offer you, for example, some jewelry or a vase that's important or a keepsake item, you don't want that to ever kind of go forward and then all of a sudden family members show up and ask, where's that, family piece or heirloom item? It's better just not to accept gifts. Obviously, if you're going for coffee or, you buy pastry, that's small and it's different, but nothing that could be monetarily seen as a high value item or any kind of, exchange of money. Ask for the family contact info. This is a newer involvement that we asked in case that a person obviously becomes befriended by you, and that as things move on, you start to interact with them. You may notice that it's important to have the contact information of their family to ensure that they're aware of these visits happening, because you're going to become a very important, pivotal person in their life. And it is important that they are aware of you and that you have obviously the most positive and hopeful aspect and tension in this person's life, of course. Now, in terms of visiting, we would ask you that you keep these things in mind. This is a little bit of note on terms of language and communication. Language obviously matters. So, for example, we use person first language. We will say refer to a person with a disability, not a disabled person. A child with autism, not an autistic child. An individual with epilepsy, not an epileptic. And then, of course, if a person uses a wheelchair, then, you have someone who uses that, not wheelchair, for example, bound or any kind of negative connotation. You obviously want to treat people the way you want them to treat you. And so it's important to give them that courtesy. Always ask first before you engage in an activity. Be willing to accept no to your offer as assistance. So if you ask to maybe push their wheelchair and they say no, then that's fine. Resolve to not, engage that further. And different people have different preferences. So sometimes people, want to eat during the visit. Some people want to listen to music. Ask politely, obviously, if you want to bring that music down, if you're going to be talking, or if they're watching TV, maybe you can lower the volume so you can have a more engaging conversation. Always be polite and cheerful, obviously, and be a good listener. Let them give them opportunity to speak and time to respond, obviously. Give them also just your complete attention and be alert of anything. So being cheerful means obviously you don't want to be the bearer of bad news and be a ray of sunshine, right, in their lives. Restrict your conversations to topics that will make the person feel better and happier. If a person is, uses a wheelchair, often remember that the chair is an extension of themselves. So don't ever touch or push the wheelchair without their permission. And just be aware, right? Giving them time. And some people will use gestures to communicate, for example. Ask them if you're understanding their gesture properly, right? There are various gestures that exist out there. You may not be understanding of all of them. So give them the time and to respond to what you mean and what they are referring to. And if the person happens to be hard of hearing, talk in a low tone voice. And this is good because it'll slow you down and it'll actually help them understand and hear you better. And if the patient speaks of a serious concern, inform the staff and or their family if they need it. Follow their need, don't force conversation topics on them, and clarify or rephrase a statement if you are unclear of what they're saying. For example, are you saying this or you mean that? If you don't understand what they said, ask them to repeat it and don't pretend that you understand what they mean. Okay, moving on. When we're talking about nonverbal communication, often what that means is the way you listen, look, move, and react tells the other person whether or not you care. And if you're being truthful and how well you're listening. And so it's very important how to listen. This is a picture of my dad and one of my kids. He happens to be the one on the left. My son is the middle child. And they had this amazing ability to match sometimes when we got together. Just spontaneously, they would wear the same type of look or clothing. And so we have pictures of them like this. And both my son and my dad were very strong silent types when they wanted to be. And my son now, Mateusz, he likes to be very quiet and mischievous at times, but he's very intelligent. So he'll often will refer to something or realize something about a situation very quickly. His perception is spot on. And so my dad and him both have the same shared qualities. And so here's an opportunity where we saw, nonverbal communication is a very important point. Facial expressions obviously mean a lot. How you react, if your face is happy or how you're sad, or if you look distracted, will show up. And so facial expression is often linked. The first thing that is noticed when someone sees you, if they see or notice fear or sadness, anger, impatience, can all be quickly revealed and affect the message conveyed during a conversation. It's very important how you feel about what they're saying. So if you express, kind of like this constricted face tone and they're trying to say something happy, then there's obviously an imbalance there, a disconnect. So, it's important to clue in and actually really zero in on what they're saying. Touch is very important. Only hold their hand if the person is comfortable with it. Respect the wish of those who do not want to be touched. Hand on hand or hand on shoulder, might be that only touch that they may experience. And so we often suggest that, especially if they're in a clinical or institution setting, sometimes when they're being moved, it's not so, it's not in a sense a way that's really caring or necessarily attentive in their way, in their emotional state. So really a hand on hand is a very nice gesture if that is encouraged or if it's accepted. And so you'll know that right away. If they pull away their hand, then you know it's not really welcomed. But as time moves on and you continue to meet with them, try to see if that is in fact something they're open to or welcoming, because it can make a big difference in a person's life. Having a personal hand on back or hand on hand, it just makes a different approach that they otherwise may not have or ever be privy to. Voice. Be sensitive to the feelings behind the words the person is speaking, right? And so they're speaking, intentionally to you. It's important to really hear what they're saying. Respond to the intonation of their voice. With eye contact, sometimes you'll see that some people may avoid eye contact, and that's important to note. And it may reveal that they're uncomfortable with what the conversation is or where it's going. Your eye contact reveals if you're interested in what they are saying. And their body movements, a way the person sits, they're standing or they're fidgeting perhaps with their hands. They could be fidgeting. Are they holding their hands tightly, or are they more fidgety? That's all important. And so body movement is a very strong indicator of how their feelings are actually believed or how they're perceived. In terms of appearance, an appearance of an individual may reveal how the person feels about themselves, their self-esteem. Often if a person's clothes are clean or there's their hair combed, clothing, all those things can kind of combine to create a picture of the individual. Clothing may reveal one's economic status. Culture is also an important influence on how appearances are judged. Appearance may also reveal if they're being cared for properly by others. If a person looks unkept, that's one thing, but if there's continual signs of that, there may be showing signs of neglect. So it's something to keep in mind. Finally, the person's space. You want to always respect their personal boundaries. Be aware of their culture, social status, prejudices, and history of physical abuse. Those may all be factors affecting one's need for personal space. Remember, it's important to be sensitive not only to the body language and nonverbal cues of others, but also to your own. So the way you receive their voice and the way they share to you and how you express yourself in return may show how important that conversation is to you as well. In terms of emotions, you want to recognize that a person may be anxious, discouraged, or frustrated for any reason during, a point of a meeting due to their situation. Don't take their unhappiness personally. So don't make it be about you, but in fact, just understand, recognize that it is something they're going through. Could be a variety of reasons for that. Don't take it to heart. When a person is angry, you want to, or if they're complaining, let them voice their frustration. Reflect back to them what they have said. So you feel anxious or you feel frustrated that this happened or so-and-so did this or said this to you. Just reflect back to them. It's a very strong strategy of how to kind of unwind the person's feelings so they don't feel so, they feel that they're not able to pass through that moment or that situation. Be sensitive, to their pain, physical, emotional, or spiritual pain that a person may have. Be aware of their current or past illnesses. For example, a person who's suffered a stroke, they may become emotional during a meeting with you. Just be sensitive and aware of that. And you may often want to validate their feelings. This is important. Though you may not agree with them, say, I understand that you may feel this way, and then voice whatever that feeling may be. Now, in terms of conversation tips, obviously we want you to use statements, things like, for example, it's windy outside, it makes me feel, anxious, or, people may find that questions are intrusive. So you may want to sometimes avoid just asking direct questions at the start. But again, as you get to know them, you may start to ask more and more questions. Be conscious of memory issues. Sometimes a person may have dementia, and so you may want to ask yes or no questions. Only ask one question at a time. Encourage them to talk about their past. Again, this is an opportunity for them to reflect. And often sharing memories is so important, right? Like asking them to talk about who they were, and that may often be clearer to them than the present. As everyone has a story, you might see that you have a plan of doing this and this, but you may only get to one or two things. So again, it's important to keep that in mind, that everyone has something that they want to share. And it's important for you to pull that and actually be able to openly have them speak about that too. In terms of conversation tips, don't be impatient. That's, we want to always exercise patience. Don't argue, and we're not there to discuss current events that might get people riled up. We want to make sure that they're calm and comfortable, and we don't want them to get too upset about anything. Don't create false hope. The sad thing is that sometimes medical situations do not always get better, so we don't want to create an issue there. And don't be dishonest or artificial. It's important to stay as neutral as you can. Everyone keep in mind, keep an open mind. Everyone has a story. And don't whisper to others. Like if someone else is in the room or involved, don't talk about them as if they weren't there. And, don't talk in front of them as if obviously they're not present. So it's important to keep these things in mind. We don't want to discuss our own troubles or question them about their illnesses. Obviously, if they share about their illnesses, that's fine. That's one thing. But if they don't share something, don't probe, obviously. And don't force them to talk. Sometimes silence is best, and you can go to a quiet space and just be, present, and maybe ask them if you want to listen to music or just reflect and have some time spent together. Don't speak in an unnatural tone of voice. Don't speak too loud. Don't point out mistakes. Again, we'll bring this point, but don't buy them gifts and don't accept gifts. Again, if there's small things, then that's another story, but other bigger items, bigger price point especially, or higher monetary value, we don't want to involve ourselves in that, right? And now in terms of ending the visit, everyone has good days and bad days. You want to adjust the visit accordingly. So sometimes what will happen is, things might happen or arise, the person gets upset or visibly you see that they're uncomfortable. You want to maybe just adjust and kind of, start to exit out of the visit and say, thank you so much. Always, always thank them for the visit. And then, short, better visit is much better than a longer, more labored one. And so next time you might visit longer. A good way to end the visit is to ask for any prayer requests and pray together if that's something they're open to. Short welcome visits are better than long ones again. And then, plan your next visit. Ask them what they would like to do. See what their initiatives, what are their interests, and thank them. Always thank them for the visit. And then finally, after the visit, keep a journal, make notes about any important names, dates, birthdays, anniversaries, how old they are, names of their children, and write that down because you may forget it later. But it's important to stir that into the conversation again on the next meeting. And that way that will encourage them to dialogue more about their lives. Keep, a journal. So this is a good point to have. Buy a journal, and that journal is actually just for that person that you will use to when you go out on your visits. Evaluate yourself, give yourself a mark, see how you did, because it's important again to share that information of how you can do better. Think of opportunities for enrichment and how to better both, their situation, things that they might be looking forward to, or things they want to take care of on your next visit, right? Sometimes seniors may want you to read a document for them or help them with filling in something. So that's again another opportunity, practically speaking, that they can engage with you and you could be helpful as well. If you have any concerns, talk to your members of your group if you're part of a group or supervisor that you're involved with. If you don't, or if you want to connect with us, we're more than happy to receive your calls. You can call our helpline here. It's a confidential line, or you can call our office as well. And that's an opportunity to connect with us on a regular basis. All right, so without ado, we're going to continue on to our last session of the evening before we finish tonight. Thank you, Alex.
The My Story program. Well, I think that Kathy's already said a couple times that the importance of the My Story program is it also gives us an in. She mentioned about the Catholic Women's League in the London Diocese, but more than that, if a parish group or a local group, or you're wanting to go visit people in a nursing home, etc., one of the ways to get in is to talk about the importance of the My Story, that you're visiting people, you're talking to them about their past. So this does many things, the My Story program. What it does is that, talking to people helps them feel like their life has meaning and purpose. Sometimes as someone in a nursing home, now they let's say they've had some health issues, they had to give up their own house, they don't have their family necessarily around them all the time. This is a totally different situation for them. In some ways, they almost, it's like being in an institution. They have to go down for dinner at 5:30. They have no choice. They've got to eat at 5:30 in the morning. They've got to eat. They've got to go to bed at a certain time, wake up at a certain time, if they're in a nursing home, that is. If they're in their own home, they may not have family members around, so they're just making food for themselves. So sometimes life can get pretty difficult emotionally. What does the My Story do? Well, we're asking about their life, right? You got to go back. I haven't even gotten there yet. I'm just doing an division. So what does it do? We're helping people, but we're allaying their depression. Why? Because they're talking about their own life. You're giving them an opportunity to talk about what they've done. This is what they call generativity. They're passing on to the next generation. They have an opportunity to share about themselves. So the gift of themselves for others. We're allaying loneliness. Well, one, just visiting them does that, but also in the area of the My Story, it's really important because you're talking about their life and how important their life is. Self-awareness and self-discovery. Sometimes people forget the amazing things they've done in their life, and it's important that we talk to them. We share with them, and they get an opportunity to share with us also about their life, and they gain more awareness and discovery with themselves. Self-esteem. Often people feel down. They feel that their life is losing its purpose. You help them with their self-esteem. Social isolation, trauma. Well, the interesting thing is, I'm going to tell you right off the bat, because the fact of it is you might be talking to somebody and sharing with them, because we have the My Story booklet, and we've got all these questions that are preset in the My Story booklet to ask people. Of course, you can go beyond that. But somebody might have had a traumatic life in the past. They might have had in childhood, they might have been hurt. They might have lost a sibling, might have lost a parent. They might have lived through some sort of war situation. And so, you don't mean to, but naturally that might be bringing up trauma. If it's a caring person, just allowing them to express themselves, sometimes there's a benefit to them having that opportunity to feel that they can speak openly about something that happened in their life. So we go on. Recalling events, feelings, or topics. See, what we're doing is we're asking them specific questions. Kathy, I think, sent you the booklet. I believe I have one right here. Do I have one here? Or Kathy can show it to you. But the booklet is set up with a basic set of questions. So it starts by asking them about their life, their childhood, their family, places they were, places they went. It gets into other issues where, were they married, etc. When you're doing a special My Story, so let's say it's a parish group as an example, and they're visiting the older members of their community as a prime example, and they're building the My Story from there. Then they might be asking them also special questions about their experience in that community. Nonetheless, you're sharing memories, you're recalling events and key topics. It can be a form of healing for a person. I'm not saying that everybody wants wounds talked about, because in fact, that's what we're not trying to do. We're not actually trying to do that at all. We're not actually encouraging that whatsoever, but it's sort of a natural reality in being human, that these things come up. Kathy, you're screaming too big on me. It improves their cognitive function. Well, you know, it's interesting when you're talking to somebody who's older and they're starting to have memory issues, usually their long-term memory is fairly good in place. It's that short-term memory that they have a problem with. You ask them what they had for dinner last night, and it's a problem. They're not sure. But if you ask them what happened when they, when they were first married or with the first job they had, they might think a second, and then they start telling you all these stories. They have an important place in this world, and it's important that you remember of this. It's a very practical thing to do the My Story. We're reviewing one's life and writing down one story. Writing down their story has many benefits. And also, people often will want to share that. I'll give you another example. You know, when we're doing the My Story, sometimes family members are saying, you know, can you share that with me? Well, obviously speaking, when you're doing a My Story with someone, the information that you've gathered is not your information. It's not for you to write a book about. They'd have to say, yes, I'd love to share that with my son or my daughter or my family members, etc. And we move on. Kathy just put the manual on the chat. So if you haven't seen that manual, you can pull it up, okay? Seniors are at much higher risk of suicide. So this is very important, this issue of depression. Men aged 85 to 89 have the highest rate of suicide than any other group. Now, this should concern you that I'm saying this because actually, historically, this group of people had a low rate of suicide. Historically, the highest rate of suicide was not 85 to 89 at all. It wasn't even close. But the culture has shifted. So now if you look at the US suicide rates, you're going to notice that 85 to 89, and then the next group is 80 to 85 as the second highest suicide rate. As I say, it should be very concerning. Now with the legalization of euthanasia and then this whole increase in suicide, you realize you have this problem within the culture. You can help to find them a purpose to live. Someone might be having a hard time feeling that they have a purpose to live. They've had their children, they've grown up, their children don't live near them anymore. They may be having some health issues, so they don't get around anymore. So it's very difficult for them. So participation in the My Story significantly will lower depression. Actually, studies show asking somebody about them, because that's what we're doing with the My Story. We're asking about them and their life, giving them a time to talk about themselves. That is of great benefit to someone psychologically and emotionally. Generativity, well, it's the ability to care for others and guide the next generation. You know what's interesting is what's been really lost in this culture is that intergenerationalism. It's a serious problem because it wasn't that long ago that it was very common. Oh, sorry, that people would grow up in a community, but in that same community, they would have their parents and their grandparents, and this was not that long ago in our human history. And now that seems to be gone completely. People wonder, what happens is let's say you were a teacher all your life, now you've retired from teaching, and 20 years later, nobody knows you used to be a teacher except for the odd student you might bump into, and they might be trying to avoid you. I shouldn't be joking. But anyway, but you know what I'm getting to? This issue of generativity, what I'm sharing with my family and my friends and others about myself. We like to think that we've done something, and we have done things. We've done very important things in this world. Being assured that one's life has meaning to others. My Story helps them connect with the past and helps them also accept their future. We move on. Loneliness. Well, loneliness is a psychological state. And as we've already explained to you, there's a risk of early death. Certainly loneliness affects people's health. It affects their well-being. Loneliness often leads to depression. My Story eases these transitions. It gives them a chance to talk about themselves. It gives people a feeling that they've accomplished something. It allays those feelings of loneliness and depression and makes them feel important because they've done important things. Remember, when you read the My Story booklet through, you realize it's been designed so that what we're doing is we're actually trying to help this person feel great about the things they've done in their life. That's what we're doing with it. And it's very good. This also, it combats loneliness when you discuss these issues. Someone who would, let's say, visit someone every second weekend and speak to them for, let's say, 45 minutes just about their past, and you're taking notes and everything. So you could say, last time I was here, we left off with your childhood, and you're telling me that your best friend was Frank so-and-so. Tell me about Frank. This is how it works. Then they get a chance to say, oh, yeah, that's right, Frank. My self-awareness, self-discovery, my story promotes and reinforces a person's place in society. And we all feel we need that. And that's important to us. And it is important to us. And it's very important. It encourages and acknowledges that they have done something in this world that's important. We reminiscent, this reminiscent therapy is very important. Now, once again, our role is not to try and be psychiatrists or psychologists or anything, because we're not. We're not trying to be that at all. All we're doing is we're visiting. We're visiting people in our communities. We're visiting our neighbors. We're visiting our family members. We might be visiting people in a church context, because that's actually the easiest way to do visiting, because they obviously have a list of people. They know who has been a member of that church, who is now a member of that church. They often will know that they're in a nursing home or not. Things like that. Reminiscence is important for people to talk about their past. It helps a person reconcile with their past and it fulfills their psychological need. Your story is important. You are important. Now, I'll give you an example. My wife, Susan, she wrote the biography of Dr. Barry DeVeber, who was the founder of the Euthanasia Prevention Coalition, but he was a lot more than that. Dr. DeVeber, he was a blood specialist in Canada. He was a pediatric oncologist. When I say he was a blood specialist, he was the very first doctor in Canada to do the Rh factor issue when for children being born, meaning the blood transfusion issue. He's the very first doctor in Canada to do that. He was also a world-renowned doctor because he was a pediatric oncologist. He got involved in palliative care in the very, 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 very early days with Dame Cicely Saunders. He was the first doctor to develop palliative care protocols for children. Very first. And he did a lot of firsts. So she wrote his book and everything by interviewing him. And it was very interesting. And yet he did so many things, but it was important to that family that she had done that. It's amazing how someone who had done so many things in life, how there was such a healing in the older years of this family as they discussed all these wonderful things that he had done. Your story is important. You are important. And he didn't have to be a pediatric oncologist to be important. Social relationships. Socialite. Oh, who are those children? Holy, come on, Kathy. Social relationships are important to us. Where in fact, as we said earlier on, the human person is made to be interdependent. That's how we tick. That's what makes us live. That's what makes us go. Social engagement. Preventing isolation. Well, that's the whole thing about visiting. But I mean, my story, I think, is like the key to doing the visiting. It's the key, getting an opportunity to speak to people. Someone might say to you, why do you want to visit me? Oh, well, I want to discuss your story, your past. You have an interesting past. So we've known of you for so many years. I want to know more about you. You've been a wonderful person in our community, or I've known you as my neighbor. I just thought it would be nice to know more about you and to share that with others. Special individual with a lifetime of experiences. We move on. Trauma. As I said, we're not trying to in any way open people's wounds. You look at the questions that we have in the My Story booklet. And if you follow those questions to start with, as I say, those are that guide, right? That's not the limit. That's the guide to get you rolling with the My Story. And someone might go down a whole different garden path, and you might have to create some questions around that just to keep it rolling well. But nonetheless, reminiscent therapy helps people deal with their past psychological traumas. And I hate to say it, but a lot of people have gone through a lot of issues. And you know, we're not opening a wound, but sometimes when there's just somebody there who actually cares, who can offer a bit of, compassion to them, that's of a great help to them. It creates a sense of peace or relief, a healing component. Now, Catherine was all earlier talking about the issue of faith, and I think that's essential to human beings, our faith, our background in our faith, our experience with faith. But there are people who've had trauma, right? And if you're doing, let's say, a group in a parish, as an example, you might bump into that. Maybe this will create some healing, but obviously our goal is not to open up that. It's not to bring in the trauma. It's not our goal at all. It's just, you're dealing with human beings. It might just happen. The basic questions are the where, what, why, how, when, who, the basic questions are all we're asking. And we go on.
Yes, thank you so much, Alex. That's excellent. So really, the training today is kind of giving you a capture of what's the My Story, and ultimately, some of the questions you're asking about who they are, what they went through in their life, where they lived, what they experienced, who, and why. So that's really what that manual is. And I sent it to you in the chat. Feel free to take a quick look at that. And that concludes our session for tonight. So if anyone has any questions, please feel free to raise your hands. And it's an electronic raising. So if you have any questions or comments, feel free to jump on right now and we can address those. And then again, tomorrow we're going to continue with the next 3 topics, which are communicating with people with disabilities, advocacy at the office, doctor's office, and elder abuse and other problems. So then we will ask you to jump back on tomorrow night, 7 o'clock, and we'll conclude that tomorrow night. Thank you.